Hello, fi iniu I Mick Giannasi, a fiu Gadareth Bod Gofal, cum de Thasol Cymru. My name is Mick Giannasi and I'm the Chair of the Board of Social Care Wales. This time 2 years ago, just as you are now, I was looking for a new challenge, an opportunity to use the skills which I'd gained during a long and varied career in the public sector to make a difference to an important aspect of public life in Wales. To be honest, I'd never heard of Social Care Wales, let alone thought of applying to be the chair of the board, but the more I spoke to people who knew the organisation well, the more attracted I became to the role. And it quickly became clear to me that Social Care Wales was a well-respected, well-led organisation which is driven by a strong set of public service values which underpin everything that it does. And everyone I spoke to, from senior government officials to key stakeholders and service users, had positive things to say about the organisation and about the people who work in it. And 2 years into the role, nothing I've seen has changed my initial impression of an effective organisation which plays an important role in keeping the public safe and enabling people who need help and support to live the lives that matter to them. And that's not to say that there is not more work to do. Indeed, the challenges which face the social care sector as we emerge from the COVID pandemic have never been greater, and Social Care Wales has an important leadership role in supporting the transformation which is required to make social care services in Wales fit for purpose and sustainable for the future. So what exactly does Social Care Wales do? Well, our primary role is to regulate those who work in the social care and early years sectors in Wales, people like social workers, domiciliary care workers and those who look after children. That means we register social care practitioners, we set standards for their practice, and we make sure that they're trained and fit to carry out their role. Beyond our core role as a regulator, we also have a wider responsibility to help develop and improve the workforce, to work with other agencies to improve the quality of social care services more broadly, and to set priorities for research and data. We're accountable to ministers for what we do, and our objectives are set through an annual remit letter. And this tells us how much funding we've been allocated each year. It's currently around £23 million, and what we must deliver in return for that funding. Our Chief Executive, Sue Evans, is the accountable officer, and she's directly responsible for leading the organisation, managing the money, and ensuring that the commitments we make are delivered in accordance with our remit. And by virtue of our constitution, she has a significant degree of autonomy to do that. So what then is the role of the board? Well, the board consists of myself as the chair and 14 independent members, all of whom are appointed by the minister. I am what is called a lay chair. I was deliberately selected because I have no previous background in the social care sector. However, my fellow board members bring a wide range of skills and perspectives from areas like education, the voluntary sector and health. We also have members with direct experience of social care, including senior managers, registrants, responsible officers and service users. But the one thing they all have in common is that they are all passionate about social care. Our role as a board is to bring an independent perspective to the running of the organisation. More specifically, we work with the CEO and her team to set the strategic direction for the organisation and to ensure that the strategy that we set reflects government policy and meets the remit which is set annually by ministers. It's also our responsibility to appoint the CEO and to hold her to account for delivering the strategy. And beyond that, we have a duty to provide scrutiny and challenge to the organisation to ensure that public resources are used effectively and that risk is recognised and managed appropriately. Although we meet regularly as a full board, most of our detailed scrutiny work is done through one of three committees: audit and risk, improvement and regulation and standards. If you're successful in your application, as well as participated in the regular meetings of the board, you will also be a member of two of those committees. Being a board member is not just about attending meetings though. You will play a part in other aspects of the organisation's work. For example, board members are actively involved in judging the accolades, which is our highly regarded annual award ceremony for the social care sector. As you will have seen from our recruitment pack, 2 of our longest serving members have now reached the end of their tenure, and this has provided the opportunity for 2 new people to join the board. For one of those positions, we're looking for someone with a background in further education, higher education or training. However, for the other, there is much more flexibility, and we have set out in the recruitment pack the kind of insights and perspectives that we think would add value to our existing membership. We're already a relatively diverse board, but there is still more we need to do to be truly representative of the organisation, of the communities that we serve. For that reason, we would warmly welcome applications from people from minority ethnic groups who are underrepresented at board level. If you haven't been a board member before, please don't be put off. We will provide all of the development, support and encouragement that you need to help you to become an effective board member. So if you think you have the skills and abilities that we're looking for, and you share our organisational values, and you have a genuine passion for social care, then I would very much encourage you to put yourself forward for consideration. I've certainly not been disappointed by the choice I made to apply to join Social Care Wales, and I'm fairly confident that if you are successful in your application, you won't be disappointed either. Thank you for your interest in Social Care Wales. Thank you for your interest in the social care sector, and good luck with your application.